Hello, my name is Yuvraj Singh Thind, and today I'm going to discuss regarding case study on meningitis. Here's our case study. I have a 19-year-old university male student who came to the emergency department. Here is his blood work, CBC, chemistry panel, lumbar puncture. Let's discuss subjective data. The patient is a 19-year-old male university student who came to the emergency department. Patient lives in a dorm of the university. Patient stated he has fever and the worst headache he has ever had. The patient further noted that his neck was stiff and it was difficult for him to lift his head from the pillow this morning. The patient also noticed a rash on his extremity and stated that the light was too bright for his eyes. Objective data. Vital signs are blood pressure 130 over 90, O2 at 98% on room air, heart rate 102 beats per minute and regular and it's high, respiration 20 respiration per minute, and temperature 38.9 degrees Celsius, which is indicated hyperthermia. The patient was observed squinting and keeping his eyes closed during the assessment. Patient is under droplet contact precautions. CBC, chem panel, blood culture, blood culture times 2, chest X-ray, and CT of brain and sinuses are done. Lumbar puncture, CHF, and blood culture confirm the presence of Streptococcus pneumonia. CT scan does not show any involvement of sinuses, and no brain edema was observed. Patient started on ceftriaxone and dexamethasone IV. Let's discuss the pathophysiology of the bacterial meningitis. Based on the patient's symptoms, vital signs, and lab and diagnostic test results, it is evident that the patient is suffering from bacterial meningitis. Meninges are the membranes that surround our brain and spinal cord, and the inflammation of these meninges is known as meningitis. Bacterial meningitis is caused by Streptococcus pneumoniae bacteria. In bacterial meningitis, the bacteria enter the subarachnoid space, which causes inflammation of meninges. It results in an increase in intracranial pressure as there is no extra space in the cavity. In bacterial meningitis, bacteria enter the central nervous system after gaining access to cerebrospinal fluid and subarachnoid space. The person infected with bacterial meningitis will experience high-grade fever, photophobia, headaches, neck stiffness, and mucosity, and rash due to the cytokines released by invading bacteria. As per the study, there is a high prevalence of bacterial meningitis in the youth living in overworld places like dormitories. Let's discuss the relative laboratory and diagnostic tests related to bacterial meningitis. Lumbar puncture is done to analyze cerebrospinal fluid. Bacterial meningitis is indicated by hazy or purulent appearance. Neutrophils and WBCs are elevated in bacterial meningitis. In bacterial meningitis, the protein levels are high while glucose is low. The intracranial pressure will be about 140 mm as the patient is contracted bacterial meningitis. CHF is a steroid, but a gram stain present indicates the infection and specific organism causing meningitis. So our patient blood work show that he experienced bacterial meningitis as he has all these findings. CBC is another biomarker that shows high levels of WBC and neutrophils, which can help to diagnose severe infections like meningitis. Also, elevated levels of CRP indicates bacterial infection, specifically bacterial meningitis. Blood cultures are done also to identify organisms and to help the doctor to determine to help to guide the treatment to prescribe medication for meningitis. Chemistry panels are helpful diagnosing bacterial meningitis and choosing the treatment. Lateral levels help to determine the inappropriate secretion of antidiuretic hormone and dehydration. The increased level of serum procalcitonin levels indicate the presence of bacterial infection. CT scans and MRI are done to find a complication related to meningitis, such as elevated intracranial pressure, brain abscess, cerebral infarct, hydrocephalus. Chest X-ray also plays a vital role in diagnosing pneumonia, especially with septic pneumonia. Let's discuss with the risk factors of bacterial meningitis. Modifiable risk factors are living in a group such as dormitories, being unvaccinated, traveling to places like Mecca and Sub-Saharan Africa, working with meningitis causing pathogens, smoking, alcoholism. Non-modifiable risk factors are age, HIV, splenectomy, cerebrospinal fluid leak, immunodeficiency, organ transplant and surgery. In this case study, the modifiable risk factor for the patient is that he is living in an overcrowded place, such as dormitory. In contrast, the non-modifiable risk factor is his age, as he is 19, and the prevalence of bacterial meningitis is higher among younger adults. Bacterial meningitis can have significant effect on other body parts. Well, let's discover the effect on circulatory system and it causes septicemia. Bacteria growth in the bloodstream releases toxin which led to septicemia, which is a life-threatening condition. Bleeding in septicemia is started as a mild rash under the skin, which leads to blood pressure fall and circulation slowdown, which damages the blood vessels. It also results in a deterioration of the kidney and lungs, and poor circulation puts arm, legs, toes, and fingers at risk for amputation. It also affects skeletal and muscular system and cause osteotonus. A back and stiff neck are common in meningitis, but sometimes it causes a condition known as osteotonus, in which the neck, spine, and head become painful, rigid, and arched. It is more common in babies and youth than in older adults. Even after the illness clears up, joint stiffness continues, and arthritis can be seen as an after effect. So we found two priority problems in our case studies. The first one is hyperthermia related to abnormal temperature regulation and infection, as evidenced by body temperature of 38.9 degrees Celsius, increased heart rate of 102, and elevated WBC. The direction behind is that the treatment of fever is a priority, as in meningitis. Fever can come on suddenly and progress quickly, which can have detrimental effect. It can cause brain inflammation, leading to seizure. Also, prolonged high temperature can cause neurological damage. Moreover, high fever can cause loss of appetite, nausea, and vomiting. The short-term goal is that the patient will regain and maintain body temperature within the normal range within 6 hours of admission. Long-term goal is that at the time of discharge, patient will be free from complication of febrile convulsion, resulting in neurological damage, and demonstrate understanding regarding the symptoms and interventions of hyperthermia. Intervention for a short-term goal is to administer antipyretics such as acetaminophen and antibody prescribed by the doctor by utilizing the 10 rights of medication. The rationale behind that is antipyretics act on hypothalamus and reduce hyperthermia, while antibiotics are given to treat underlying cause of infection, thus preventing seizure activity. Intervention for a long-term goal is to assess and monitor patient temperature and maintain adequate fluid intake as tolerated during the hospital stay. Also provide education to the patient by discussing demonstration and handles regarding the signs and symptoms and intervention of hypothermia, and help with the factors related to the occurrence of fever. The rationale behind is that the monitoring the patient vital signs will help to assess the effectiveness of treatment, and maintaining fluid intake will help to prevent dehydration. Also, providing education to the patient will allow him to cope and avoid further complications of hyperthermia. The evaluation of short-term goal. Within 6 hours of admission, the patient temperature is decreased and able to maintain a temperature of 36.8 degrees Celsius. Patient also stated that he is feeling better now. Evaluation of long-term goal. At the time of discharge, patient was free from febrile convulsion, and the patient demonstrated the education gain regarding hypothermia by return demonstration and verbalizing. The second priority problem is acute pain related to meningeal irritation and increased intracranial pressure, as evidenced by headache, neck stiffness, photophobia, and difficulty lifting the head from the pillow. Reason behind is that the presence of neck stiffness and headache shows increased intracranial pressure and meningeal irritation. It is priority to treat acute pain, as it will comfort the patient and prevent further complications of bacterial meningitis. Short-term goal is that the patient will verbalize comfort and relief of pain and rate pain 2 out of 10 within 45 minutes. Long-term goal. During the hospital stay, patient will comfortable and able to manage other symptoms and complications of meningitis, and demonstrate understanding regarding the symptoms of meningitis such as headache, neck stiffness, and photophobia. Intervention for a short-term goal. Administered analgesic, opioids, antibiotic, and corticosteroids prescribed by the doctor. Rational. Analgesic and opioids help relieve pain, while antibiotics and corticosteroid therapy ease pain by reducing inflammation. Intervention for a long-term goal. During the hospital stay, assess the patient's headaches and sensitivity to light, keep the patient room atmosphere calm and dark, and provide him with health teaching through discussion, handouts, and demonstration to cope with and manage the symptoms of bacterial meningitis. Rational. Meningitis can trigger headache and photophobia, so it is important to assess headaches and sensitivity to light. Also, keeping the room environment quiet and dark will alleviate headache and photophobia. Moreover, providing health teaching to the patient regarding the symptoms and intervention for meningitis will help him to manage these symptoms. Evaluation of short-term goal. Within 45 minutes, the patient verbalized comfort and relief from pain and rated pain 2 out of 10. The patient stated he is feeling much better as his headache is gone. Evaluation of long-term goal. During the hospital stay, the patient was comfortable and able to manage the other symptoms of bacterial meningitis, and demonstrated understanding regarding the symptoms and intervention of meningitis by verbalizing them and by return demonstration. Here's my references. Thank you. Thank you so much.